sure it's not news to anyone in this room that autistic people in Scotland are facing a crisis in mental health. Much has been said already by government, NHS and other agencies about the need to prioritise mental health provision for us. Why we, as autistic people, are facing such mental health challenges, however, what the main barriers are that we face in accessing support, and what can help, I think isn't as widely understood or recognised. This is a problem, because despite the well-intentioned aims of the autism strategy, equal access to services, provision of appropriate support, and so on, it is impossible to bring in meaningful changes without this understanding. And to gain that, we should be listening to autistic people properly, hearing stories and experiences that are all too common within the community, but under-acknowledged outside of it. Last year, to this end, the organisation that I chair, AMAZE, the Autistic Mutual Aid Society Edinburgh, carried out a survey of autistic people around Scotland, asking them about their experiences with accessing mental health support. We had already heard repeated stories from our members and other autistic folks across the country of people being denied mental health treatment on the grounds of their autism diagnosis, of people not being understood or taken seriously when they're in crisis, and of no appropriate services being available or provided. These are basic facts, sadly acknowledged within the autistic community, but often not known outside of it. The turning away from mental health services on the grounds of our autism diagnoses, for instance, has been met by disbelief from a number of NHS and related professionals, claiming we must be talking about unusual isolated cases or misunderstandings. However, in the report on our findings, Too Complicated to Treat Autistic People Seeking Mental Health Support in Scotland, published last year, we found that over a quarter of those surveyed said that their autism diagnosis was a direct barrier to them receiving the help they needed, with quotes like, "As soon as my autism diagnosis was confirmed, I was kicked off the mental health waiting list. I am told that depression and anxiety is normal for me, and mental health services said I was too complicated for them to treat." While 64% said that being autistic has been a barrier more generally to them receiving appropriate mental health care and support, whether through lack of understanding, lack of physical accessibility of services, such as requiring phone calls or unclear information, lack of advocacy, or lack of the right kinds of support. Let me just spell that out again. We're talking about a population where over a quarter of people seeking mental health support are directly denied it because of their neurology, and well over half struggling to access support for related reasons. These include people in crisis, who are isolated, people who have tried to reach out when they are suicidal, people who have had to live with huge amounts of anxiety every day and finally can't handle it alone anymore. According to some studies, autistic adults without learning disabilities are 9 times more likely to take their own lives than non-autistic people. We are reported to have a 20-year lower life expectancy, yet we are struggling far, far more than the non-autistic population to even have our difficulties in gaining mental health support acknowledged, let alone gain access to appropriate care. 8 years ago, the Scottish Strategy for Autism set out its goals, which included, within 2 years, access to mainstream services where these are appropriate, access to services which understand and are able to meet the needs of people specifically related to their autism, and removal of short-term barriers, such as unaddressed diagnoses and delayed intervention. Also, within 5 years, access to integrated service provision across the lifespan, consistent adoption of good practice guidance in key areas of education, health and social care, and capacity and awareness building in mainstream services to ensure people are met with recognition and understanding of autism. Autism Rights Group Highland and the Highland User Group also published a report in March of that year, which gives us a snapshot of the state of mental health provision for autistic people in Scotland at that time. It received responses like, "Sometimes because we have a diagnosis of autism, our mental health is disregarded and we are excluded from services. People were encountering a lack of understanding of autism and a lack of appropriate services, saying, 'They don't listen, they treat us as if we're broken non-autistic people. I'm afraid to talk to them because they will always get it wrong. And following an autism diagnosis, now they have almost washed their hands of me. They now ignore my mental illness. Now that they have changed the label, I get no help.'" Does this sound familiar? The quotes are dispiritingly similar to those I cited earlier in our report. It's been 8 years. 8 years in which removal of basic short-term barriers in accessing mental health services, such as accessibility requirements, have not been addressed. 8 years over which time equal access to mainstream services do not seem to have significantly improved, and the fact that folks are being turned away due to their autism diagnoses still comes as a surprise to far too many responsible. 8 years over which time specialist services have not only not expanded, but those that have shown best practice in support of our mental health have struggled for funding and existence, or had their flexibility or capacity eroded. Both the 2017 Arc Highland One Stop Shop report and our mental health report showed that some of the few places making consistently positive contributions towards autistic people's mental health in Scotland are some of the Autism one-stop shops, specifically in Highland and Edinburgh, that were mentioned by respondents, for their provision of community, non-judgmental understanding, advocacy and stability. I would like to remind folks here that one-stop shops operate with wildly different offerings across the country. These were singled out for doing it right. I should also highlight that these are not even mental health services and do not have the specific expertise or capacity to support autistic people with our specific mental health difficulties. But they try because there's often so little else, and without them, far more of us would be in crisis. In fact, mainstream mental health services regularly refer autistic folks to their local autism services, if they exist, even when that's not what is needed for treating mental health difficulties. Okay, so this whole talk has been quite gloomy and angry so far, but I hope you can see that we have a right to be. Any population that has such high incidences of stigma, isolation, misunderstanding, and the mental health troubles that unsurprisingly come from that, any population who are at such high risk of suicide and related mental health crises, but who are not being given priority in accessing the support needed, has an absolute right to be very, very angry. But I'm not here just to shout depressing, angry things at you. While the autism strategy might perhaps seem retrospectively overambitious in its 2, 5 and 10-year goals, there have always been relatively simple solutions to a lot of these problems. You could have, and still can, just ask us. Autistic people are representative groups and autistic professionals in mental health, and those familiar with issues facing the community. We do actually exist. Read our mental health report. Read the National Autism Task Force Guide to Quality Care for Autistic People. Read Autism Rights Group Highland's One-Stop Shop and Highland User Group reports. Autistic people have been working hard to be heard for quite a while now. It's time you listened. Our Amaze Mental Health report ends with several concrete recommendations from the autistic community, from those of us with lived experience of being autistic and trying to access mental health support. I think they're all extremely achievable, some even in the very short term. We need you to make services consistently accessible. At the latest Autism Strategy Review Group meeting, a question was raised by one of the local authority speakers. Some NHS services, she said, are very clear in terms of information and access, but mental health services aren't. Why not? Being able to make a phone call should never be a requirement to access a health service, especially one that might aim to be helping you with your anxiety. Going to a scary assessment should never be a mystery tour of unclear information and unwritten rules. Making access like this consistent is not rocket science. We're also still waiting for an urgent review of why autistic people are being turned away from services on the grounds purely of their autism diagnosis. The fact that this is not acceptable and that most autism services that exist are not a replacement for referral to mental health services needs to be propagated to all GP and frontline services. We need the message broadcast across health and social care services that autistic distress often doesn't look like neurotypical distress, and mental health treatments have not been designed with autistic people in mind. We need flexibility and to be part of the dialogue. We need to be listened to and taken seriously when we say we need help. We need you to acknowledge the importance of what specialist and beneficial support there is, that the autistic community is saying is valuable and is saving our lives. We need to know that places such as Highland One Stop Shop isn't going to be closed down from lack of funding. Good services for autistic people aren't merely day centres or social work advice shops. They are services run by autistic people and proper allies, which acknowledge and understand our differences, serve as translators and advocates, and provide opportunities for community and belonging. Acknowledge what the good services are doing. Learn from them. Give them the support they need. Don't use them as a stand-in for specialist mental health services while stripping them of funding. Again, we implore you to listen to us. Ensure that ignorance and misunderstanding about autism is tackled through training and guidance run and written by actually autistic people, with understanding and relevant expertise in the areas involved. Work with autistic people's organisations and autistic professionals. Develop new approaches by collaborating with us. Realise that once you talk with and listen to us, we're actually not necessarily so complicated to treat. You can't expect to work with neurodivergent folks if you cling onto neurotypical expectations. I'm going to leave you with a message from one of our survey respondents. I want the government to know that if we are given the right support, we really can thrive.